Hi, it's Kenneth again. Now we're going to talk about a cancer policy. There are two main types of cancer policies: the lump sum cancer policy and the cancer policy that's going to pay you a certain amount and a little bit alone. The easiest one to discuss is the lump sum. With this cancer policy, it's going to have basically a certain amount that'll pay for skin cancer. Generally, some do not cover skin cancer on this. Um, and then basically your remaining amount, if you had to use it for skin cancer, would be used for um, basically if you had internal cancer, and it would pay the rest of the benefit. Once it's paid, it cancels and you cannot get a cancer policy again. The other type of cancer policy that you can get is one that pays basically per item and doesn't cancel. I prefer these cancer policies for the simple fact that if you get cancer once, you're liable to get it again. So the biggest factor here is you want to get this policy just because if you get cancer, it's going to cover you, and then if you have a relapse, it's going to cover you. This one usually has an initial benefit rider, and that basically will give you a certain amount for basically the doctor just saying, you got cancer. As long as he says it and basically puts it in writing, you get paid for it being in the notes that he said you got cancer, even if it turns out you do not have cancer. Um, that rider cancels as soon as you use the uh, payment. The next thing about it is it's going to pay you so much little alone. Now, each cancer policy that's like this is a little different. Some won't pay on experimental treatment, some will. We have both. Um, some will pay, uh, well, they all pay for like chemo, medicine, doctor's visits. If you have to go so far from home, they pay a certain amount for your mileage. They pay for a hotel room for somebody that goes with you to stay in. Um, So, and the mileage is generally 50 miles away from your home. So as long as you're going 50 miles away from your home, then you're covered. Um, when it comes to um, other things that you can have an increasing benefit rider. Also, this policy generally has a wellness benefit. So, women, you go have a mammogram done, you get a certain amount. Men, you get a colonoscopy done or a prostate exam done, you get a benefit amount. Blood work that you have done, if they do a cancer test in it, you get a benefit amount. Um, some of them basically just going to the doctor for a regular checkup, they will give you a benefit amount. Um, and there's many different things in these policies. The easiest way to learn all about them is to sit down and go over a policy. This is just meant to give you a brief overview. Um, some of these policies won't cover skin cancer. Others, you can have it cover skin cancer, but it's going to pay a lesser amount for skin cancer than it would for the internal cancer, just because skin cancer is likely to be cured. Um, I hope this video was helpful in giving you a little understanding of what a cancer policy is and how it can benefit you. Thank you, and I hope you have a good day.